Med history.
Syphilis is a systemic infectious venereal disease caused by Treponema pallidum, which is mainly sexually transmitted. Syphilis can cause serious health problems if left untreated. The infection affects the skin, mucous membranes, nervous system, internal organs, and musculoskeletal system. The disease is characterized by a staged, recurrent, progressive course. Pale treponema is a spiral-shaped microorganism. Outside the body, Treponema pallidum dies when heated, dried, under the influence of most antiseptics, acids, and alkalis. It is preserved at low temperatures and in a humid environment. Treponema, causes of syphilis. Most often, the source of infection is patients with early forms of syphilis in the first 2 years after infection, with wet rashes on the skin and mucous membranes. Ways of infection: the genital tract, the most common and typical route of infection. Infection occurs through damaged skin or mucous membranes. The transplacental pathway. Transmission of infection occurs from a sick mother to the fetus through the placenta and leads to the development of congenital syphilis. Transfusion route, with blood transfusion from a donor with syphilis at any stage. The contact household pathway is rare. It is registered mainly in children as a result of household contact with parents who have syphilitic rashes on the skin and/or mucous membranes. The professional path, infection of laboratory personnel working with infected experimental animals, as well as obstetricians, gynecologists, surgeons, dentists, pathologists, forensic experts in the performance of professional duties. Immunity to syphilis is not developed, so you can get infected again. According to official state statistics, there is a gradual decrease in the incidence of syphilis in Russia as a whole. In 2018, the figure was 16.7 cases per 100,000 population. Against the background of a decrease in the overall incidence of syphilis, there is an increase in the number of patients with neurosyphilis, with a predominance of its late forms. More than 70% of cases are among young people between the ages of 18 and 30. Features of the causative agent of syphilis. The causative agent of syphilis is the pale spirochete microorganism, Treponema, Treponema pallidum. The pale spirochete has the appearance of a curved spiral, is able to move in different ways, translationally, rotationally, flexibly, and undularly, multiplies by transverse division, and is colored with aniline dyes in pale pink. Pale spirochete, treponema, finds optimal conditions in the human body in the lymphatic pathways and lymph nodes, where it actively multiplies, and appears in high concentrations in the blood at the stage of secondary syphilis. The microbe persists for a long time in a warm and humid environment, optim T = 37 degrees C, in wet linen for up to several days. Resistant to low temperatures, in the tissues of corpses, viable for 1-2 days. Pale spirochete dies upon drying, heating, 55 degrees C after 15 minutes, 100 degrees C instantly, when treated with disinfectants, acid solutions, alkalis. A patient with syphilis is contagious in any period of the disease, especially during periods of primary and secondary syphilis, accompanied by manifestations on the skin and mucous membranes. Syphilis is transmitted when a healthy person comes into contact with a patient through secrets: sperm during sexual intercourse, milk from nursing women, saliva from kissing, and blood, with direct blood transfusion during operations. From medical staff, using a common straight razor, a common syringe, from drug addicts. The main route of transmission of syphilis is sexual, 95–98% of cases. Less often, an indirect household path of infection is observed through wet household items and personal belongings, for example, from sick parents to children. There are cases of intrauterine transmission of syphilis to a child from a sick mother. A necessary condition for infection is the presence in the patient's secrets of a sufficient number of pathogenic forms of pale spirochetes and a violation of the integrity of the epithelium of the mucous membranes and skin of his partner. Microtrauma, wounds, scratches, abrasions. Periods of syphilis. The course of syphilis is long-term undulating, with alternating periods of active and latent manifestations of the disease. In the development of syphilis, there are periods that differ in a set of syphilides, various forms of skin rashes and erosions that appear in response to the introduction of pale spirochetes into the body. Incubation period. It begins from the moment of infection, lasts on average 3-4 weeks. Pale spirochetes spread through the lymphatic and circulatory pathways throughout the body, multiply, but clinical symptoms do not appear. A syphilis patient is unaware of his illness, although he is already contagious. The incubation period can be shortened up to several days and lengthened up to several months. Elongation occurs when taking medications that somewhat inactivate the pathogens of syphilis. Primary syphilis. It lasts 6-8 weeks, is characterized by the appearance of pale spirochetes of primary syphiloma or solid chancre at the site of penetration and subsequent enlargement of nearby lymph nodes. Secondary syphilis. It can last from 2 to 5 years. There is damage to internal organs, tissues, and body systems, the appearance of generalized rashes on the mucous membranes and skin, baldness. This stage of syphilis proceeds in waves. Periods of active manifestations are replaced by periods of absence of symptoms. There are secondary fresh, secondary recurrent, and latent syphilis. Latent syphilis has no skin manifestations of the disease. Signs of specific damage to internal organs and the nervous system is determined only by laboratory tests, positive serological reactions. Tertiary syphilis. It is rare now, occurs in the absence of treatment years after the lesion. It is characterized by irreversible disorders of internal organs and systems, especially the central nervous system. It is the most severe period of syphilis, leading to disability and death. It is detected by the appearance of tubercles and nodes, gum, on the skin and mucous membrane, which, disintegrating, disfigure the patient. They are divided into syphilis of the nervous system, neurosyphilis, and visceral syphilis, in which internal organs, brain and spinal cord, heart, lungs, stomach, liver, kidneys, are damaged. Symptoms of syphilis. Primary syphilis begins from the moment when a primary syphiloma appears at the site of the introduction of pale spirochetes, a solid chancre. A solid chancre is a single, rounded erosion or ulcer with clear, smooth edges and a shiny bluish-red bottom, painless and non-inflamed. The chancre does not increase in size, has scanty serous contents, or is covered with a film, a crust, and a dense painless infiltration is felt at its base. Solid chancre does not respond to local antiseptic therapy. The chancre can be located on any part of the skin and mucous membranes, anal area, oral cavity, lips, corners of the mouth, tonsils, mammary gland, lower abdomen, fingers, but most often it is located on the genitals, usually in men on the head, foreskin, and trunk of the penis, inside the urethra, in women on the labia, perineum, vagina, cervix. The size of the chancre is about 1 centimeter, but it can be dwarfed, the size of a poppy seed, and gigantic, D equals 4-5 cm. Chancres can be multiple in the case of numerous minor lesions of the skin and mucous membranes at the time of infection, sometimes bipolar, on the penis and lips. When a chancre appears on the tonsils, a condition resembling angina occurs, in which the temperature does not rise and the throat almost does not hurt. The painlessness of the chancre allows patients not to notice it and not to attach any importance. The soreness is characterized by a slit-like chancre in the crease of the anus and a chancre, paniridium, on the nail phalanx of the fingers. During the period of primary syphilis, complications, balanitis, gangrenization, phimosis, may occur as a result of the addition of a secondary infection. Uncomplicated chancre heals in 1.5–2 months, depending on the size, sometimes before the appearance of signs of secondary syphilis.